Hi, my name is Chinwe. Imagine the usefulness of smartphone and tablets in helping you to communicate with your loved ones and everyone that matter to you. These same devices, smartphones and tablets, imagine that they can also be used to control and monitor your blood pressure while you're in communication with your healthcare provider, while staying in the comfort of your home. Exciting, right? Yeah. Today, we're going to talk about how they can help us. So, but before that, let's find out what hypertension is. So, what is hypertension? The heart is the organ of the body that pumps blood throughout the body. And when it does that, as the blood moves through the vessels, the force with which this blood moves is what is called blood pressure. We have the pressure when the heart is relaxing, that is called the diastolic, and the pressure when it is contracting, that is called the systolic. Either way, the blood pressure needs to be at a particular level for the body to function normally. But in a case that the blood pressure is abnormal and is consistently abnormal, then a person is said to have high blood pressure. And we don't want that because normal blood pressure is needed for normal functioning of the entire body. And there is no other way to know if your blood pressure is high or not than knowing the numbers. So it is important that we know our blood pressure numbers. And that is why hypertension is usually called a silent killer, because most people are moving around not knowing that they have high blood pressure. So your blood pressure needs to be below 120/80 for it to be in the green zone, as you can see. Then when it starts getting higher, between 120 and 129, then it is getting in the yellow zone, getting elevated. Then if it keeps going higher and higher and it gets into 130, then you are in stage 1. And if it gets even higher, above 140, you're said to be in stage 2 hypertension. And we don't want anybody in this red zone. So anybody's blood pressure that is in this red zone needs to go back to the green zone. So we need to control it. Okay. And if we don't control it and it keeps staying in the red zone, there are so many things that could go wrong. The person can have paralysis and have stroke. The person can have elevated sugar in the system and have diabetes, which is not good. The person can go blind. The person can have heart attack, and even the heart may stop working. The person can have damaged organs, like the kidney will stop working. And we definitely don't want that. So everything we do is to get people back to the green zone. That is why we are working towards controlling high blood pressure. And how do we do that? We can do that by changing your lifestyle. Start eating better diets. You stop smoking if you are. You reduce your alcohol intake. Then engage in exercises. Then you can also have medications. If these lifestyle modifications don't work for you, your doctor may prescribe medications for you. There are so many medications that the doctor can prescribe for you. The ones listed here are just examples. You discuss with your doctor depending on your body and your body system and other things going on with you. Your doctor will choose the right medication to give you. Then let's talk about the problem of hypertension in the US. Over 120 million people in the US have hypertension. And only about 6 out of every 10 are aware. And even at that, only about 5 out of every 10 are receiving treatment. And among those that are receiving treatment, only 2 out of 10 have their blood pressure under control. So there is a serious problem. And every year, blood pressure costs us over $50 billion. And the number of people that have died within 10 years from 2008 to 2018, 6 out of every 10 of them were attributed to high blood pressure. So we have a serious problem that needs to be dealt with here in the US. And how do we do that? We're already trying medication. We're already telling people about healthy diet. We're already telling people to modify their lifestyle to imbibe better living behaviors. But most importantly, we want to get people to be more involved in their care. And we can do that through technology applications by the use of mobile health technologies, like the use of our smartphone, our tablets, and other wireless devices. These devices can help us in monitoring and controlling our blood pressure. If you look at this graph, you will see that there has been consistent increase in the number of people that use smartphone over the years. And as of 2019, 8 out of every 10 adults now have smartphone, and almost every person now use cell phone. Also, a number of people using internet have also increased over the years. And right now, 9 out of every 10 adults use internet. So these technologies have provided avenues for us to take advantage of in blood pressure monitoring and control. So a patient can sit quietly in his house, measure his blood pressure, then send the numbers through digital means to his provider, and the provider will review it and then send back to the patient a feedback. And depending on what the numbers are, the feedback can be adjust your medication. The feedback can be don't do anything, you're doing okay, keep doing what you're doing. The feedback can be counseling, do this or do that. Then the feedback can be urgent care. Yeah, you need to come in right now. We need to take you in and check you. So, and all this could be done just staying in your house through technology. And this is what we call telemonitoring of blood pressure. So it's a very good opportunity that technology has provided for us to help in monitoring of blood pressure. Research has shown that self-monitoring of blood pressure alone has led to improvement in control. But when self-monitoring is combined even with telemonitoring, we even have greater improvement in blood pressure control. So more people are already doing self-monitoring, like 7 out of 10, but we still need more people to come and embrace telemonitoring. And how do we get more people to embrace telemonitoring of blood pressure? And this is the main work I'm doing to try to understand how do we get more people to embrace remote monitoring of blood pressure. That's telemonitoring of blood pressure. So I'm trying to find out what are the characteristics or traits of the people who are already using their smartphones and tablets in achieving their health goals and communicating with their healthcare provider. When we find them these characteristics and traits, then we can apply them to get more people to embrace this telemonitoring that is so helpful in blood pressure control. And to do that, I'm using a national survey that is called Health Information National Trend Survey. That asks people questions about access and use of health information. So I'm going to use that to find out these characteristics and traits I just told you about. The knowledge that we gain from this research, we help our healthcare providers to engage more patients in BP telemonitoring through their smartphones and their tablets, and then we'll have healthier and longer living patients. And we know we all love that, because our goal is for everyone to be healthy. Our goal is to get hypertension under control, and everyone will be happy. Thank you.